My name is Maxwell Ekwee. I am a dentist. I work with River Jordan Medical Center, and we're born and based in Boy as a main branch. But we also do have our other branches. One is in Mtito, now starting. We have one which is in Maungo, and there is a main branch here in Wakengali, and then another one in Kariako. That's a premium branch. Mtito Andei was a very interesting dynamics, especially with the community. A lot of cases came through. Some of them were actually dental surgical needs that we found on the field. We were able to assess them. We were able to sensitize the community. We were also able to teach them oral health. But most importantly, we were able to provide them with elementary dental treatment that we could be able to offer in the field. And such, of course, included a simple tooth extraction. A few others like restorations, those ones we refer them to the main branch where the machineries are set. However, once the place is fully operational, we expect to have a full dental unit fully equipped, available for the community to access a whole range of dental services. And the main branch, we actually run through the entire dental service line scale. That include a normal extraction. That one we were able to provide in Mtito because we had carried some few kits with us. We do a dental restoration, that is dental fillings, of course coming through from amalgam filling, composite filling, the glass enamel filling, root canal, crowns, bridges, all those are falling under prosthetics and of course ortho aspect of it. So we recently also introduced alignment for our clients to ensure that they have a good smile, restore their confidence, among other things. I think the most important thing that people need to take care of is actually get access to information, and that is what now we have decided to give a priority to. Why? Because once you have an information, you have knowledge, the correct kind of information that you need to use, then you will make decisions that actually favor you, and you will have a good oral health, of course, within you. Now, too, what thing we notice within this community is that most of our patients wait to actually experience pain before they can move on to pay a visit to the dentist. And yet, it is important that you actually go to do a normal checkup with the dentist, and they'll be able to find out exactly where the challenges are coming from, what interventions can be done, and then you'll be advised accordingly. So, like we always say, do not wait for pain to come before you can go and check up with the dentist. Make sure you go there early. And also, we need to be aware that not all dental visits will result into a procedure. Sometimes we simply need to be assessed. And if the problems are starting to crop, then it is also important that you're informed, you're given the guidance, you're given the correct practices that you now can adopt to in order to mitigate the risk of losing teeth, the risk of having dental pain, and other complications that come along. A normal set of teeth will be 32, just like you can see here. However, a lot of times, there are so many things that happen. From your young age to the time that you have grown, so many changes that are actually anatomical, physiological, with everything that we do will change. And some of the things that affect these changes include the environment, the activities that we go through, sometimes of course the accidents, sometimes the trauma, and so many others. However, if all factors remain constant, we expect a normal adult to have 32 teeth, the same way you see it is arranged here. And then of course, in old age, you will find people who are starting to suffer from what we call gingivitis. They have a lot of calculus, and in most cases you'll find their front teeth are actually shaking and it's bleeding a lot. And if that is not looked at, it could lead to a loss of teeth. And yet, it is not a procedure, it's not a condition that would have a lot of pain, because in most cases, many people are actually forced to go and see the dentist because they want to get rid of pain. And what if there is damage getting done and you're not feeling the pain? So what will be that trigger factor for you to actually go and see the dentist? Now that's a part where we encourage every other client, every other dental potential client, I would say, or a patient, to go and see their dentist irrespective of the time, whether they have pain or not. And yeah, once in 6 months is very ideal. That would guide you, because most of the dental condition will start as small as it is in a very small space, but that will continue to progress, and yet you're not feeling pain. You have no sensitivity. It can take 2 years, can take 3 years, even 4 years. By the time you start to get warning signs of pain, that particular situation has actually escalated. And that means it is going to cost you money to address the situation. It is going to cost you a tooth that you may end up losing. So an early visit to the dentist will save you from pain, will save you from finances, will also save you from inconveniences. That would work a lot. So many people would grab their toothbrush the way it is, and then they just go ahead and do this and do that. No, that is inappropriate, because as you look, if you continue doing in this particular pattern, there is going to be what we call wear and tear. You're going to have a very deep cut, sharp edges around here, and that would expose the tooth to sensitivity. We rather encourage that you adopt the circular motion formula of actually brushing your teeth. You run this in a circular manner, and you are able to clean all the surfaces of your teeth. All right, so once you have it like this, you can actually open your teeth as well. Open the mouth this way. You're able to access these other surfaces, then access the other surfaces and run through on the lower side, and the same thing will go up and in on the other side. Now, the challenges, of course, that we get with many of our clients is that they are not able to access the far back teeth that are in their mouth, and that particularly I'm talking about the last molar on the upper side and the second last molar. Why can't they access when they're brushing their teeth? They open their mouth big. This is approximately 50 degrees or 45 degrees around there. So once you have that, already there are muscles around the side that will retract towards the jaw, and it would create what we call an obstacle to you accessing the far back of your teeth. Now that would now mean you are actually unable to clean them well, and the caries will become accommodated there, and that is where the issues will begin. Now, how do we therefore make that kind of changes? We encourage that after you've opened your mouth and brushed most of your teeth, most of their surfaces, we advise that you reduce the mouth opening to approximately 15 degrees or 20 degrees. By doing that, the muscles towards the vesicle will actually relax a bit, and then it can be able to retract away. And by doing that, you are able to now access the tooth with your toothbrush to the far back and clean everything around that area. Now, when you do that, you are able to actually maintain a healthy mouth, but brushing alone is not enough. People should learn to actually do flossing. Now, flossing will help remove the the food particles that are stuck in between your teeth, and that would help you a lot by actually in avoiding caries. But as if that is not enough, even the mouthwashes are there. That would help maintain a healthy gum. So all these are a combination of activities aimed at ensuring that you have a healthy gum, you have a good mouth. Dental department is a very interesting unit. It is the only department actually that has got patients who will come and choose whatever they want. Because when you arrive and you have cases, you have a dental problem, then we can discuss and say, okay, fine, now I need to have a filling. And then I'll tell you, look, maybe your condition is quite much and you may require root canal therapy. And then we tell you information about it and you make that decision. However, we are now moving more centered into the community to try and support the community with more sensitization geared towards prevention of dental caries or dental conditions that are there. When you prevent dental conditions within the community, then you're also supporting them in terms of saving with their finances. But while we do that, we also create interventions to actually support those that we're not able to give them information early enough and they're already having dental cases. So we have a range of procedures that we give them. And of course, like I had already said earlier on, we of course do sensitization, that is oral health education for them. We do dental fillings, that is restoration. We do root canal therapy. We do teeth replacements, both in dentures, partial dentures, full dentures. we do a bridge, we do crowns, and we go on like that, up to, of course, the high-end service line for dentistry. So those are things that we actually look at. And I am very pleased to inform the community within Voi and River Jordan that with dentistry, you have got to do your bit as an individual. As a dentist, I can only do for you about 40%, but 60% is entirely on you, the client. But you'll be able to utilize that 60% to your advantage. When you receive the correct information from your professional, you are able to practice it, and by doing that, you limit or reduce your visit to the dentist with dental problems. Yes, all the clients, everyone who will need to see a dentist, I think there is no better place you will look for except River Jordan Medical Center. We're here for your good. We're here to deal with you, to give you a service that is worth your while, to ensure that we design a pocket-friendly system to support and give you dental care that will leave you very comfortable.
Jina naitwa Andei, mkaji wa Mtito Andei. Nashukuru kwa matibabu imekuja. Wajua saa ingine watu tunalemewa matibabu kwa sababu ya hii finance inatufunga. Tunaumia kwa manyumba tukiwa tunajua tunaweza kupata usaidizi, lakini hatu pesa hakuna. So unajua hali vile ilivyo siku hizi. Na sasa tumesikia hii mwito, hai lazima tugetokea, na tunashukuru kwa maana ile huduma mnafanya ni very sweet, ni very, yani ni nzuri, yani inapendeza. Hamna ile roho ya kukorofisha watu, haina roho ya yani kuweka watu roho mbaya ati achukie. Ni kitu kinapendeza yenyewe. Yani wakati walikuja tena Mtito Andei, walinitoa meno na akanipa dawa za sukari. Unajua nitakuwa na diabetes na niliendelea vizuri. Sasa nikasema hii wakija hapa najua atapata kazi, kwa maana kazi yao inapendeza. Unajua kuna mtu anaweza akapungua kazi, ama hospitali unaweza kaenda useme huko utarudi tena kwa vile ulishukuliwa, vile ulihudumiwa. Lakini sasa hapa naona kuna yani umutu ndani, utu, kuna utu kuonyesha you care for the sick.